Good afternoon, everyone. Thank you so much for joining us today. I hope that you're all doing well, and hopefully you've been enjoying some lovely spring weather wherever you are. My name is Molly Garone. I'm a Senior Communications Coordinator for the Choices Project at the Prevention Research Center on Nutrition and Physical Activity at the Harvard T.H. Chan School of Public Health. And as always, it is a pleasure to be facilitating today's coffee chat. The topic for today is Improving Social Determinants of Health, Year 2, Getting Further Faster Project Findings. As always, I want to acknowledge our funders who make this work possible and also share that our Choices work and events are for research and educational purposes only. The intention of our coffee chat today is to provide information, tools, and resources to inform and educate, and note that we are not looking to influence any specific legislation. If you are unfamiliar with the Choices community of practice, I'll just briefly describe what it is. The Choices community of practice includes people whose work focuses on advancing obesity prevention, healthy eating, and active living, and want to learn more about how cost-effectiveness analysis can advance their efforts and address health equity. And it's our goal to support these efforts by providing tools, resources, and training opportunities. Our coffee chats are kind of unique, informal opportunities to gather ideas, innovate together, and get to know each other better. And for today's coffee chat, we will be listening to a short presentation from our guest speakers, and then we'll have some time for a full group discussion. We encourage all of you to share any questions or comments in the chat throughout the event today, so please feel free. For today's coffee chat, we are delighted to be joined by partners from the National Association of County and City Health Officials, or NACCHO, and the Association of State and Territorial Health Officials, or ASTHO, who will be sharing key findings from the second year of their ongoing project funded by the Centers for Disease Control and Prevention, Improving Social Determinants of Health, Getting Further Faster. This project is focused on understanding the role of public health in supporting work involving social determinants of health. Getting Further Faster focuses on assessing the work of multi-sector partnerships and coalitions to address social determinants of health and advance health equity. Our goals for the event today are to hear about the key findings and lessons learned for the role of public health in advancing social determinants of health from the Getting Further Faster project. And as always, for all of you to network with peers and learn from others about opportunities and current resources to support this type of work. So again, we're really excited to be joined by our partners from ASTHO and NACCHO. First, we are joined by Erin Bayer, who is the Senior Director of Chronic Disease Prevention and Health Improvement at the Association of State and Territorial Health Officials, where she is responsible for the overall vision and successful implementation of various chronic disease projects throughout the states and territories. Prior to her role at ASTHO, Erin worked in state and local public health across North Carolina in various areas of prevention and health policy. Erin's career has primarily been focused on implementing policy, systems, and environmental changes, and has had notable successes in tobacco prevention and control, nutrition and food access, active living, healthy community design, and clinical community connections. So thanks for being here with us today, Erin. We are also joined by Stephanie Weiss, who is the Director of Chronic Disease at the National Association of County and City Health Officials, where she manages several chronic disease projects, working with local departments on topics such as tobacco and cancer prevention, diabetes, cardiovascular disease, and implementation of food service guidelines. Prior to her tenure at NACCHO, she served as the Associate Director of the Food Trust, where she provided technical assistance to communities across the country on food access and nutrition policies and programs. Stephanie also worked as a program associate at the Robert Wood Johnson Foundation, where she managed a grant portfolio on childhood obesity prevention and tobacco control. So welcome, Erin and Stephanie. We are so happy to have you both joining our coffee chat today. And at this time, I'm going to turn it over to our speakers for their presentations. So take it away, Erin and Stephanie.
Great, thanks, Molly. And if you don't mind advancing to the next slide, we'll get started. So It's really a pleasure to be here, to be back again. Stephanie and I presented at this time last year with the year one findings of the project. So excited to provide just a brief overview of what has taken place and then updates on the second cohort of the initiative. Next slide, please. So a quick overview of what we'll be addressing today. So again, an update of the initiative. And we're really going to focus on some of those higher level findings and insights that we feel would be most applicable to this particular group. We don't plan to dive too deeply into the details of the evaluation approach and kind of get into the granular nitty-gritty details, but we certainly can provide some additional details on that afterwards. Stephanie will spend some time talking about the training and technical assistance resources that were developed as part of this project and what the sites, what they received as part of participating. And then for this year, we did have a communications component, and so that will be highlighted. And then a brief insight into what the next steps are for the third year of this project. And then I'm hoping to hear from you all a little bit about the work that you're doing and then answering questions. So next slide, please. Great. So as you've heard, we obviously will be discussing the social determinants of health. And although this slide does say we're going to be discussing the why, I don't think that I have to do any convincing to this group about the importance of addressing social determinants of health, that I feel like many of us have been working in this space for quite some time, and many of you are likely very interested in bringing this into your practice if you have not already. So Healthy People 2030 sets an excellent standard, a great way of sort of simplifying the social determinants of health, but basically looking at a way to create social, physical, and economic environments that promote, an opportunity for everyone to attain high quality health. So for this particular project, Getting Further Faster, we take things down a bit more and not looking at those higher level social determinants like poverty or education or transportation, but really those that are focused and have an impact on chronic disease prevention. So next slide, please. That because we're working directly with the Chronic Disease Center at CDC, and they have a tremendous amount of expertise in all areas of chronic disease, the areas that we did focus on are the built environment, community clinical linkages, food and nutrition security, social connectedness, and tobacco-free policies. So as mentioned, we just finished the second year of this project. In the first year, we worked with 42 communities to conduct a rapid retrospective evaluation and to identify some high-level findings of why these communities were successful. They also received training and technical assistance. So next slide, please. So here's an overview of the recipients that we worked with in year one. As you can see that we have a good variety of geographical locations represented, and many of the sites were actually focused on more than one of the SDOH areas. Again, the 5 listed here, but majority of them focused on more than one intervention. Next slide, please. So as part of the new and most recent work, our year 2 recipients, we actually worked with 14 of those original 42. So those 14 communities were selected, they applied and were selected based on really their ability to identify data and health and attribute the data to health outcomes. So really be able to report out on the success of their work. While they were all doing phenomenal work, there were a subset of individual sites that again had the ability to dive deeper and to connect those resources. And so those were the ones that we worked with. And next slide, please. So in the second year, as mentioned, that it's kind of a 2-prong approach, the project as a whole, that we worked with RTI as our evaluator to conduct an evaluation of the 14 sites. And then also there was a training and technical assistance component too that Stephanie will go into some detail on. But diving into the year 2 evaluation approach. So as you see here, it's sort of a 3-pronged approach. The first being really engaging with the community organizations and the partners and the community members to gain insight into the work that they were doing and what challenges they had, what made them successful, and how this could potentially be replicated, or how lessons learned could be shared with other communities either involved in social determinants work or on the brink of it. The second component is taking that data that I mentioned earlier and the resources that were readily available and able to be shared, and having a summary and outcome of that component, and being able to look for individual successes, but also continuity across each of the sites. And then last but certainly not least is the PRISM component, and that is a proprietary cost analysis effort conducted by RTI, excuse me, looking at the overall cost and the cost savings by completing these interventions. And I know that will be an area of interest to this particular group because of some of the similarities with the choices cost effectiveness analysis. We are not going to get into specific details of that today because of it being proprietary to RTI, but happy to provide links to some of our manuscripts that describe it in a bit more detail. And I think there also might be an opportunity to have them provide some additional details, maybe in a future coffee chat. So. But we were really looking overall, to get a bit more detail on the specific roles of health departments, either state or local, as it relates to these community partnerships and how they contribute to social determinants of health work. And as I mentioned, the cost and cost of these interventions and some of the cost savings. And but also wanted to know from the communities what made these community partnerships successful. How have they been able to sustain them? What are some of the challenges? And then what are the strategies that others could possibly put into place? So next slide, please. Okay, so again, keeping things very high level. I know we're kind of limited on time. So we did find that in all 14 communities that the partnerships, these community-based partnerships that we worked with, all 14 of them really were not the sole reason, but were a vital reason for the success of social determinants interventions. And because of their access to data, because they have strategic plans in place, that they really focus on that community engagement and, you know, bringing the people who are impacted, bringing them to the table to be part of that discussion. Oftentimes these partnerships were already in existence, many of them we actually found that the communities that were most successful were those who had been in partnership for 3+ years. And then we also found that all 14 of these sites that they had state or local health department involvement. And I think half of them had both state and local health department involvement. So 13 of the partnerships, they actually contributed to the physical enhancement of their community. And that was either through farmers markets or bike lanes. In some communities, we saw the implementation of boat and canoe ramps to help increase access to waterways, greenways, and sidewalks. So the physical improvement of their communities was a big component of their work as well. And then additionally, we found that 86% of the communities had health outcomes data that they were able to access and attribute to the work that they had done. So that looked very different in many communities. So it was everything from decreased hospital administration or admissions, increased community clinical linkages where the hospital system was assessing for needs related to social determinants of health and then referring to those community resources. So as well as improved health behaviors and overall healthcare utilization cost decrease. Next slide, please. All right, so diving a little bit deeper, again, many conversations were had with these community-based partnerships and the community members that they pulled to the table to do all of this fantastic work. So some of the findings on how these partnerships were sustained, obviously good communication was key. We found that frequent communication was vital while building those initial relationships, but also it was important to continue to have those future-oriented conversations in order to maintain those partnerships in the long term, knowing that work can kind of has its ebbs and flows, and that in order to sustain sort of the membership of these coalitions was really vital to both talk about the here and now and the day-to-day, as well as those futuristic goals. And having those shared expectations and that vision is a huge part of that. We found that some partnerships had formal like MOUs, I guess, in place. Some were a little bit less formal, but really having that shared understanding of what each organization was contributing, and making sure that that was sort of, there was a shared responsibility, even as it relates to funding, knowing that if only one community or like one partner led the way, if they lost funding, that it could stop the whole effort as a whole. So kind of having that decentralized, lead partnership role, that it really was a shared effort. And this will come as no surprise to anyone, but sustained funding was a vital role in sustaining these community coalitions and these partnerships. Next slide, please. All right, so as I mentioned, all of those participating in the Getting Further Faster initiative, all of these multi-sector partnerships, they all partnered with either state or local health departments. And so obviously, both Stephanie and I are going to be a little bit biased in that we work for ASTHO and NACCHO and really see the value in health departments, but it was reassuring and affirming to see that play out in these partnerships as well, to the contributing to the success of social determinants efforts. So and part of the roles that the health departments contributed to in each of these communities were providing that technical assistance and sometimes specific resources. And that could look like providing evidence-based resources or toolkits, even input on language for new policies. Sometimes they provided direct funding to the community partnerships or to the community as a whole. They absolutely, in public health, we are connectors and strategists and conveners. And so we found that really played a huge role in being able to connect the community partnerships either to one another or to decision makers at the local or state level, as well as other key collaborators that were doing similar work or others that could really contribute to the benefit of the partnerships. And then in a few communities, we also saw that some health departments actually provided staffing support, whether that was in a few instances, maybe the health department staff in a local health department was helping to carry out the day-to-day operations of a farmer's market, or really helping to kind of be the boots on the ground for some of those efforts that the community partnerships had conducted. Next slide, please. So also another vital component and another key player at the table of these partnerships is the healthcare delivery system. Again, probably not a surprise to anyone, but all but one of, so 13 of the 14 sites that we worked with had healthcare partnerships of some kind. And we found that consistently in the year one evaluation as well. And I think the big part really is that access to data. We find that to be such a consistent thing throughout all of this work, is that having access to data and the ability to share it and utilize it as evidence to the benefit of their work, that was really key. Sometimes the physicians or the healthcare delivery system as a whole, as I mentioned earlier, they were conducting the social determinants of health screenings and then connecting to resources in the community or connecting to the resources that these particular partnerships had developed. And then sometimes it was as simple as providing some funding or workspace. So again, overall, just significant benefit and a recommendation for those either looking to enhance their social determinants work or those just getting started, that having the partnership with state and local health departments as well as the local healthcare system. And then lastly, just really high level, again, not getting too detailed into looking at the potential long-term impact on cost around this type of work, but utilizing the data that was provided by the multi-sector partnerships, we did estimate that the annual cost per person reached for the different types, that they ranged from $12 per person to approximately $91 per person, just depending on the intervention. And so it's a pretty big variance there, but really depends on the type of intervention that the community was working on. But overall, they were able to analyze 13 of the 14 partnerships and found that about $7.4 million was spent on across a year within or working on these interventions. And, about 50% of that was spent on labor cost. So that really goes to show that the physical, the manpower, if you will, is such a vital component to this. So having people in place that are able to be those connectors and to do the work and to pull the groups together. And the funding sources varied as well, that depending on the community partnership. So again, sometimes state and local health departments provided funding. Some were from local grants from the healthcare system, some were foundation funding, and then even in a few instances, there was some federal government agencies that provided funding directly to these sites. All right, so I know we have to move quickly, and at this time, I'm gonna pass the baton to Stephanie.
Thanks, Erin, and thanks, Choices, for having me here today. So Erin kind of talked about the one prong of the project, that we like to think about, of kind of looking backwards retrospectively of what made these coalitions successful. And I'm going to talk a little bit about, how we supported the coalitions in kind of their journey moving forward. So we did provide training and technical assistance in year 2, and I want to note that this work was done by our partners at Mathematica, and many of the slides here we took from them. So wanted to kind of note that at the beginning, that they really led this TTA effort really during the first 2 years of this project. In addition to the sites working with RTI, they were able to engage, because we worked with a much smaller cohort this year, we were able to provide much more tailored and specialized training and technical assistance to help advance the coalition goals, as well as the goals of the project. And much of the design of the training and technical assistance really came from the feedback we heard from year 1, as well as an assessment that Mathematica conducted with the 14 awardees at the beginning, to kind of hear from them what they most wanted to prioritize and get out of this. So you can see here kind of the types of TA that were provided. As in the previous year, Mathematica conducted a series of virtual training and technical assistance workshops that were, interactive, that really spoke to topics of greatest interest, greatest need, as well as, priorities amongst the project partners, CDC, ASTHO, and NACCHO. They were also able to introduce, with this smaller cohort, one-on-one coaching, where sites were kind of paired with the team at Mathematica to focus on their individualized coalition goals, address challenges, and they met with those coaches monthly. And then finally, Mathematica created and provided resources to the sites that they worked on, kind of through those other 2 modes, through the TTA, through the virtual events and coaching, around specifically around policy planning and sustainability guides that we'll touch on in a minute. Next slide, please. So here you can see the key topics that were covered through the TTA period. I'm not sure why health equity isn't kind of outlined the way the other sustainability planning, policy development, and communications are, but those top 4 were really covered across all types of modes of TA. We did hear that some sites were also interested in getting technical assistance around evaluation, continuous quality improvement, and data use and management. And those topics were primarily covered through the one-on-one coaching and TA. So I'm going to just briefly introduce you to 2 very comprehensive resources that were developed by Mathematica and are going to be shared with you today to kind of take back and take a look at. Again, this is really kind of high level. We're not going to get into the nitty gritty, as Erin said, of the details, but really just wanted to provide a frame and introduction, and hopefully somewhere down the line we'll have some opportunity to do some more extensive training on the guides and what's included in them. So the first one is the policy planning guide that was developed through this process, and Mathematica really took a co-design process. So they brought in the coalitions to help kind of co-design this with them to see like what they wanted to include in it, what would be most useful, what exercises, who should be part of it, and I think that really kind of strengthened the final product that was put forward. And this resource is, as you can see here, it's kind of listed out the topics that are included there, but it's really meant to be a roadmap that can kind of help coalitions chart their course, monitor their progress, make corrections, come back to, work on multiple policies at once, different levels of policy, so state policies, government policies, as well as institutional policies, or even policies within the coalition and partnerships. So really meant to be a flexible tool that folks kind of use ongoing and come back to. There are links to exercises and other resources linked within the tool for information on different parts of it. And I think what we learned and what we heard from the coaches that through this process was that, even, with these very high performing coalitions that were selected for this process, they were at very varying points in their capacity to engage around policy. So this tool is really meant to kind of meet folks kind of where they're at to move forward, one or multiple policies related to improving chronic disease and furthering SDOH in their through their coalition. All right, next slide, please. So the second resource that I'm just going to quickly touch upon is a similar resource also developed through Mathematica, this time focused on sustainability. So this is a theme that we, heard over and over again, and I think all of us in public health always have sustainability on our minds, primarily thinking from the funding perspective, and I know Erin touched on that, but we, as part of this project, we really wanted to take a broad view of sustainability, knowing that it can mean, many things to many people. Next slide, please. So here you can see, while funding is included, there's many other sustainability domains, also included within this guide. And the guide really kind of walks folks through, the general terms of sustainability, the different types of sustainability, and also a series of worksheets and exercises on how to prioritize which aspects of sustainability to focus on and then set goals. So again, Mathematica worked with their coaches, the Mathematica coaches worked with the coalitions to work through these exercises and start planning for sustainability goals for their coalitions. Next slide. So finally, as we kind of, after a whirlwind 9 months of TA and evaluation, these sites really crammed a lot into a short period. Mathematica did conduct a post-TA assessment at the end of the period to really help inform us on how we, both through this project and as ASTHO and NACCHO as membership organizations, can better provide training and technical assistance around chronic disease prevention and improving social determinants of health, and how we can work with coalitions and how local and state health departments can best help fill that need. So here you can see just some of the topics that rose to the top. I think related to choices, there was a real interest in additional support and resources around return on investment strategies, and one of the workshops held through this was focused on that, and there will be a one-pager that will be available to the public when we build out kind of our public resources page. We also heard that there was interest in continuing the sustainability and policy support for policy planning activities, as well as ongoing opportunities for peer learning. So we will be kind of taking all this into account as we move into the next phase of the project. Next slide, please. Okay, the final component of the project, and we heard requested from coalitions around the need to really support strategic communications and how to tell their story and the impact of the work of their coalitions, how to showcase their data and results. So we worked with Health Plus Studios as our communication contractor to provide some of those resources to the site. So each site worked with Health Plus and was fortunate enough to create a 3 to 4 minute video showcasing their work and highlighting the impact of their coalition, as well as create another kind of collateral piece that they felt was needed to expand their coalition, talk to other key stakeholders in their community. So that could be a one-pager, an infographic. Some folks asked help with redoing their website, things like that. So the communications team really worked with them on framing and telling their story, designing, and then creating those. Next slide, please. One overarching resource that was developed more for the public through this project and through Health Plus was this framing resource around how to talk about social determinants of health. So you can think of it as kind of a primer on how to talk to non-public health audiences about social determinants of health work, and how to reframe and explain things in plain language, and using some of the communications research that Health Plus and their partners at Frameworks Institute had conducted to really get and convey the message across in a meaningful way to other stakeholders. So unfortunately, we don't have an online version of this yet, but I believe that Choices will be able to send through the PDF document for those to share. Next slide. So just quickly before we get into kind of our discussion questions, just wanted to give you a peek into kind of what is next for our team. So we are in process of planning for the development of kind of a full community of practice that will be open to the public. So in the past 2 years, it's really only been open to folks that were funded through this program, but we are looking to take all the resources that have been developed over the past couple years and create a public online forum, as well as some additional training and technical assistance support that will be open to the public. So stay tuned for that. We are in the planning phases, but hopefully we'll have more to share in the next couple months. And then we'll also be working to disseminate the findings from the evaluation that Erin mentioned earlier more broadly, as well as those tools and resources. And then thirdly, we just finished and are in process of contracting with our third cohort of awardees for this project. And this current year is going to shift slightly in that the focus of working with a cohort around the retrospective evaluation will be looking at how health departments and nonprofit hospitals and potentially health service organizations are working together to address social determinants of health. So looking at community benefit dollars and philanthropic hospital dollars and what the impacts of those have been on community health. So I think that is all we have for now. Hopefully that gave you kind of a flavor of all that we've been working on over the year. And like Erin and I both said, I think each of these topics could easily have been a standalone presentation. So we know we put a lot of information out there. There is more information about the overarching Improving Social Determinants of Health project on CDC's website. And then you have Erin and myself's contact info here.
Wonderful. Thank you so much, Stephanie and Erin. That was such a great presentation. I think you shared such a great recap of your learnings from year 2 and so many useful resources. Folks should note in the chat that we shared links to those resources. So thank you so much. I would like to take a quick moment just to ask you both a question to get a little more insight and sort of help connect everything that you've talked about back to our choices work. So again, you shared so many wonderful resources, and I think the policy planning guide and sustainability planning guide in particular sort of have a bit of overlap with our choices work and some of the concepts that we think about. In particular, we think about the concepts of effect, reach, and cost when we're looking to evaluate the cost effectiveness of programs and policies. And effect kind of looks at the impact on health. Reach asks how many people will actually benefit and who. And the cost, of course, looks at what the cost will be to implement a program or policy and what the healthcare cost savings might be. So in maybe 2 minutes or so, I would love if you could give a little bit more insight into how those concepts of effect, reach, and cost factor into the policy planning guide and the sustainability planning processes, and how they could both help to contribute to making more informed decisions and evaluating costs and resources that might be associated with implementing a certain program or policy.
Sure, I can start off, and then Erin, if you want to jump in with anything I've missed. I think you really just highlighted it there, that I think a lot of the core concepts that you all are working on in choices, really align with both the policy planning process that's outlined in the guide, taking a look specifically at, there's one section in the guide that you'll see when you'll take a look around the policy analysis planning process and worksheet, and kind of taking a look at similar to those things that you just mentioned. So I think that a lot of the same things are there. They may just be listed under different names. So I know in the guide it's listed as kind of taking a look at feasibility, the impact, the economic cost, and the support and buy-in. So I think all of these are really kind of tools that coalitions can use to kind of better understand what's happening and how to prioritize, which policies make sense to maybe move forward on now versus kind of lay the groundwork for something in the future based on the data and information that they have.
And I'll just add that, I think it's important to capture the effect, the reach, and the cost, and to communicate that, whether to funders or potential funders, to elected officials. I think that's a big part of either as a projection or as a real-time amount to really justify, getting started with this work, or to justify continuing it. So I think, as Stephanie mentioned, that the communication component of this year was really vital for all of those reasons, to be able to take that and share it with others. So.
Thank you both for this additional context, and again, for this terrific presentation.